Brilliant.
That's
So
started now.
thanks. So welcome to the East Lothian IJB on the 26th of June today. The meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. East Lothian Council and NHS Lothian are the data controllers under the DPA. Data collected as part of the recording will be retained in accordance with the Council and Health Board's policies on record retention. The webcast of this meeting will be publicly available for up to 6 months. So Fiona, over to you, I think, for the roll call to start with.
Okay, thank you, Chair. First of all, the apologies. We have apologies from Jeremy Finlay, from Elizabeth Gordon, David Binney, John Hardman, Kalondi Kasangeli and Claire McIntosh. Are there any other apologies that anyone's aware of? No. I'll move to the roll call. Shimeen Akhtar.
Present.
Lynn Jardine. Carol McFarlane.
Present.
Jonathan Blaisby.
Present.
Patricia Cantley.
Present.
Andrew Cogan.
I'm present.
Maureen Allen. Darren Bradley. Lindsay Byrne.
Present.
Sarah Gosner.
Sarah's on annual leave. She sends her apologies, Fiona.
Thanks, Fiona. David Hood.
Present.
Claire MacDonald. Marilyn McNeil. Liam Kerr. Mike Porteous.
Present.
And Fiona Wilson.
Present.
And we also have Councillor Liz Allen here today.
Thank you. Yes.
And I've just seen that Lynn has joined as well. So
Great, thank you.
okay.
Can I just ask if any members have any declarations of interest to make? No. Great, thank you. We're ready to start the business, Chair.
Okay. Shimeen, you want to come in?
Yeah, just my apologies. Darren from Unison handed in his apologies when I was engaging with him, and I realised I hadn't passed it on, so sorry.
Thank you.
No problem. So welcome everyone. I detect that this is getting close to the Scottish school holidays and there's a number of people away. So it's my son who's a teacher's last day, and I know a number of other people their children are finishing today. So I gather that's the reason why that. Before we get into the meeting proper, I'm glad Lynn was able to join, because I just want to, I think you're here till about 3 o'clock from what the email said. So whilst you're here and we're all here, can I just put on record mine, and I know everyone else's, thanks for the contribution that you have made to the IJB and to Audit and Risk Committee over the last few years. We will really miss your contribution, and we wish you every success and good wishes for the future. But thank you very much, Lynn.
Thanks, Andrew. That's appreciated.
And on that note, we also welcome Liz. I think there's a paper about this as well, but Liz, you are most welcome. And Shimeen's already reached out. I'm sure Fiona and myself and others, we're here to try and help you to fulfil your role within the IJB. So please shout, and we'll do our best to help with that. So you're very welcome.
That's very kind of you. I know I have big shoes to fill, so I'm not sure I will be able to do that, but I'll certainly try. Thank you.
Thank you. So we'll move on to agenda item 1, which was minutes of the meeting that was held on the 22nd of May. So firstly, if there's any typos or things, then please share them with Fiona. But I'm going to quickly go through page by page just to see if there's any matters arising or issues that people want to raise. Page 1. Page 2. Page 3. Shimeen.
Yeah, just on page 3, at the bottom of page 3, the integrated model for day centre and dementia meeting centre in Musselburgh. I know there was an update provided earlier in the week, and I just wondered if it would be helpful to get that update at this formal meeting about progress on this.
Yeah, happy to do that. Happy to do that now. So I don't know if one of the officers wants to update on that. Fiona or colleagues? Laura, sorry.
So there was a press release, I think, just confirming that the IJB was agreeing the funding. I don't think there's any further update though. Still work going on to look at, to try and find a premises, etc. Is that what you meant, you mean, just the press update?
Yeah, just to get an update.
It was just
Yeah,
a press update to say that the IJB had agreed to, and we were moving forward, etc. There wasn't anything else above that.
Would you be able to come back when there's more progress to add to that? That'd be helpful.
Yeah, I don't think it'll be till, I wouldn't imagine, so they're looking for premises just now, and I suppose it'll be later in the year, October, November, I think, by the time they've tried to access premises, find out if it's okay, and then we'll know from then. So I could bring something back more concrete later in the year or early next.
We won't lose sight of that, Shireen. I'm sure Laura and colleagues will update accordingly. Jen, do you want to update?
Yeah, just to say that the press release has gone out, but I haven't picked up any kind of coverage on it as yet, but I will keep monitoring and we'll let you know.
Great. Thank you. I'll carry on then and move on to page 4 and page 5 and page 6. Shireen?
It was just on page 5, the second paragraph. Mr. Porteous had said that he advised that additional monies for community services may come from the Scottish Government later in the year. And I know at the end of January, the government had made a statement saying that there'd be greater portion of new NHS funding going to primary and community care. For there's no better way to deal with illness than to prevent the addressing of conditions early and intervening to prevent disease. And there was an allocation of 10.5 million to build GP capacity and to intervene early and to prevent illness. I think it'd be something that if we could try and keep a track of where that is and what that means for East Lothian. IJB is one of the fastest growing areas in Scotland. It would be really helpful to ensure that we get our fair share of that resource.
Fiona or Mike, have you heard anything about this pot of money? Is it truly new money? Do we know yet?
So unless Mike's going to tell me something different, Shireen's raised this before, so that's helpful, and we've raised it with NHS Lothian, and they're not aware of any money, and just we're looking for more detail. It was also raised at the board yesterday, so we're not aware of, even though the statement was made, where this money is, and NHS Lothian have not got any that have come into their system. So Mike, unless you're going to tell me something different, but we have addressed it from Councillor Actor, just flagging it a couple of times just to make sure that we are raising it just from a consistency and transparency perspective. Mike, did you want to add anything?
No, just to say you what you said is absolutely correct, and I undertook to keep an eye on things and liaise with colleagues in the health sector just to find out to keep track of any letters that come in advising us of new money. So once we're aware of it, we will obviously update people on that.
I have a significant level of assurance that when allocations are actually made and money hits the systems, then they are distributed appropriately and in accordance with all the rules and regulations around that. So I'm confident of that. Less confident of when individual press releases come out and where that money links to. So I think we take on board everything that Fiona and Mike have said. But Shireen, I'd love those monies to become real and to be followed up with allocations. And we wait and hope, I think. We'll carry on then. And I was at the page 6. Page 7. Page 8 and page 9. I'm seeing no more hands. We then have the ongoing action log, and there's a couple of things on there around the first item there was to, as part of the development session, some issues to feed into that planning process. I'm going to continue to do verbal updates unless there's something significantly substantive where I'll do a written paper. And we said we would pick up the Clinical and Care Governance Committee reports after it's been through to Healthcare Governance. So I have no other outstanding items to note there. Okay, thanks. We'll move on to number 3, which is a very brief report from me. And all I'm just going to, and I've sent a document, I asked Fiona to send the document round, is that in the last week, we have had not 1, not 2, not 3, but 4 documents issued by Scottish Government. I've sent around the letter from Caroline Lamb, the Chief Exec of NHS Scotland. I think it's really important that IJB members take the opportunity to have a look at that and the 4 supporting documents to it. I think there's going to be quite a lot of issues for us to consider. I don't propose that we do that here, but I propose that we feed that into a development session planning, give members the time and the opportunity to read those documents and then to begin to assess what the implications of those documents are. I've read, I can't say I've read all 4 in great detail. There is, I think Shamin hinted at it in the statement before, it is signifying the continuation of the shift from hospital care to community care, which I think we all welcome. I have to say there was very little mention of IJBs in any of the documents that I have read. There's some mention, but I'm not quite sure what it's saying about IJBs, and that's something I think that we need to reflect upon. But I think that overall direction of travel is very positive. But I think we should spend more time once people have had a chance to read and digest that to do that through a development session. John.
Well, yeah, I agree, Andrew. I mean, it's really good to do that development session. But just to state the obvious, obviously, as we get on to talking about the strategic plan and objectives, we need to be clear and sure as an IJB that we are linking very closely with what the Scottish Government has said over those 4 different reports that are all interlinked. So I suspect we are looking at how I might look at it, but it's obviously somewhat difficult given you're reading 4 different reports in particular. I think there were 4, I don't know, I felt like I was reading 10 at a time, but one time. But yeah, and I'm sure that's what actually we're doing when I look through the strategic objectives. But of course, we need to be just clear in terms of the governance side of that, perhaps, or just practicalities about making sure we do it over the coming months. Thank you.
Yeah. Laura, your hand's gone down, did you?
Yeah, just because I suppose John's already really said it. I suppose just assurance that, you know, we are tying that into strategic plan. It wasn't ready for when we were doing first draft, but yeah, and in some ways it's been helpful as oh, look, we are doing it right. So that's positive. But yeah, it's just linking it all together, and it is a positive for us, I think, because it really does help emphasize the way we want to move forward with our third sector and our community approach to health and social care and that preventative model. So it's useful in that way. But yeah, for that assurance, we are certainly picking it up within the strategic plan.
Yeah, I think it will be a factor of our lives for the next few years in terms of how that policy is implemented and our role within that. So that was my brief update there. So on to agenda item 4, which is just the paper around the confirmation of membership changes. Fiona, do you introduce this and go through it, or I'm not quite sure who does the process on that one.
I can do it if people are content with that. That's fine.
Very content.
Thank you. It's not easy when there's 2 Fionas, is there? Okay, so this paper is just to update the IJB of a change to its voting membership and to seek nominations and IJB approval for a change to the membership of the Audit and Risk Committee and appointment of a new chair for the committee. The IJB is asked to note the appointment of Councillor Liz Allen as a voting member, replacing Councillor Lynn Jardine. It's asked to seek nominations and IJB approval for the East Lothian voting member in the Audit and Risk Committee to replace Councillor Jardine, and to seek nominations and IJB approval for the appointment of a new chair of the Audit and Risk Committee. And the background is outlined in the paper. I'll pause there.
Thanks, Fiona. My view is that the first bit is, we said it before, thanks Lynn, welcome Liz. I I think we're all very supportive of that. I'm not sure we need to rush in today for the audit and risk issues. There's a few voting members not here, so and I don't think we have a meeting on the immediate horizon. So I think we should just let this lay for a few hours and then have some conversations offline on that. So and then bring that back once we've identified someone. Fiona Curry.
Thanks, Chair. Just to say, we have a meeting of the Audit and Risk Committee before our next scheduled Integration Joint Board meeting. So we may well need to at least address the issue of membership of the committee and the chair now rather than later.
I take that on board, Fiona, but I also know we haven't got people missing who
Yes,
might
no, I
be
appreciate
wishing to
that.
express an interest. So we need to get the balance there. So Lynn.
Just to say that I know Jeremy's not in the meeting. Jeremy is the other member of the Audit and Risk Committee from the council membership. So you currently have Shameen, Carol and Liz in this meeting who you could possibly make the appointment of my replacement from, and then maybe leave it up to the Audit and Risk Committee to decide who the convener chair is at their next meeting.
Mm-hmm. And I think Elizabeth is on the Audit and Risk Committee as well. So Elizabeth, and the first thing is there any volunteer to replace Lynn? And that resolves that one, and then the committee itself can then determine a chair. Shameen.
Sure, I'm happy to volunteer myself to be on it.
Okay. Are we content with that, colleagues? I'm seeing some nods. So, and then we leave it to Audit and Risk to then choose chair from within its own membership. I'm happy with that.
We need to ask members to formally agree that, because in the standing orders, that's the IJB that takes that decision usually. So if you're happy to delegate that to the committee.
I'm happy to delegate that to the committee. Guide me if I'm going wrong on this, Fiona Curry. This is okay. That we are. I'm still only second meeting in, so I'm still learning on this. So, Shameen.
I just wanted the opportunity to make a comment before we went to the formal section, so you just let me know when to come in.
Okay.
If I can just confirm that would be the third recommendation in the report would be amended to agree to delegate the appointment of a new chair to the committee members, rather than the IJB approving it.
Mm-hmm. And I think we can then ratify that and note that at the next IJB meeting.
Yeah.
Okay. And I'm seeing plenty of nods and things. Shameen, did you want to come in then?
Yeah, just to just for the paper, just to thank Councillor Jardine for her work on the IJB and for the Audit and Risk Committee, and for taking it on. So thank you, Councillor Jardine, and just to welcome Councillor Allen onto the to the IJB today.
Okay. Thank you, Shameen. So I take it we're okay with the Audit and Risk Committee now, and we can move on to agenda item number 5, which is an update and review of the strategic plan. I think, Claire, we're handing on to yourself on that.
Yeah, thanks, Chair. So this report provides IJB members with an update on progress in relation to review of its current strategic plan and the development of a revised plan. It presents a set of draft strategic objectives and delivery priorities for initial IJB consideration prior to further development. So, the draft objectives and priorities that are presented today in the appendix are based on a number of things. So in part, they are based on analysis of local and national context in terms of demographic and population health data. They also take into consideration the wider strategic landscape, so including national strategies. We, as we've been developing these, we've been aware of the draft population framework work that's been going on, as as well as other Scottish Government announcements on strategic directions. So happily, what we've got in draft form chimes with what's come out in the previous week in terms of sort of direction of travel. We also take into consideration our local partners' delivery plans, so NHS Lothian and East Lothian Council strategic priorities, and they reflect feedback gathered through a number of engagement activities to date. So we've been carrying out engagement since the start of the year. So we reflect some of that feedback, but also feedback from previous engagement, including the Planning for Older People's Services engagement, which took place over the last couple of years. So the proposed draft objectives are summarised at paragraph 3.4. So they are a smaller number of strategic objectives than previously. So in the current strategic plan, we've got 7, and the proposal is to reduce these down to 3 strategic objectives. So this is to help ensure that it focuses on sustainability of key services, given the increasingly challenging context with demographic change and constraints on resources. And that change, or that recommendation for change, for that smaller number of objectives, is based on engagement feedback to date. So Appendix 1 gives quite a bit more detail of the rationale behind each of these proposed strategic objectives. It also identifies a number of delivery priorities related to each. Again, the rationale for each of these delivery priorities and some initial thoughts on specific activity required is outlined. So the next step will be over the July-August period into September is to carry out some public engagement. So colleagues are supporting that work. We will develop some materials to support that, so to make it an accessible discussion with local communities and other stakeholders. We'll also be developing a consultation draft, so it'll be working up some of the detail of what we've got at the moment and presenting it as a consultation draft in September, and then that will go on, undergo a more formal engagement period based on the statutory guidance. So that's our first number of prescribed consultees that needs to go to. We're still working towards the target of having a final draft of the revised strategic plan to go to the IJB in December for approval, and we're on track at the moment to deliver that. So happy to take any questions or pick up any feedback at this point.
Thanks, Claire. So open this up to any questions or comments for Claire. Shameen?
Yeah, thanks, Andrew. Claire, that was really helpful getting all of it summarised together. And I was just looking at the transformation and the change. And I know further on in the document, you do mention shift in the balance of care. And I just just mindful of that. If we don't get that shift in balance of care, that makes some of the transformation and change quite difficult, because there's quite a few areas where we don't have the level of locus or the ability to change as much as we should have. And it was just to have that was kind of my only comment around it, that I understand having transformation and change, and that we will transform or significantly change how services are planned and delivered. But how do we make sure that actually we're requiring our partners to shift the balance of care? And another reason why I say that is all the chief officers did a presentation to NHS Lothian, and there was one common theme right throughout, and that was kind of the set aside services, and everybody was feeling the same about the shift in the balance of care on those areas. So it was just how do we incorporate this? We will transform and things will be carried out differently, but we want a very much stronger in the next 5 years, a far more stronger shift in the balance of care than we have done over the last 10 years. We've kind of seen it in kind of small piecemeal ways, but we need a real transformation shift from our partners on that area. And that was the kind of only comments I had on it.
Thanks, Shameen. John?
Okay, do you want me to go, or I don't know if there was a response to what Shameen was saying there? No?
Sorry, Claire, did you want to respond to that?
Yes,
just a statement.
So I think we have tried to pick that up in the strategic delivery priority, and we've also picked it up in one of the priorities that talks about working with Lothian partners to look at the use of set aside. So we have noted that in the draft at the moment. So obviously that's up. We'll have further discussion. There's also in the draft format a bit of content on intermediate care services and the need to continue to develop these. So yeah, noted, and we'll continue to kind of emphasise these points.
Okay, thanks. And the other one, which is around housing. I know on page 33, working in partnership, there's a small mention of housing, but we're seeing more and more cases coming through where the health and housing meetings are happening, and the levels of need around health and housing and meeting people's needs that have got a whole range of different mobility and health issues, just having a much stronger focus on that as well.
Glad you want to come back on that as well?
Yes, and again, I think, Siobhan, we've reflected that in the delivery priorities just at a high level at the moment, and some of the detail will be added as we go on. So in a number of instances throughout the draft, we've pointed to other programme strategies or delivery boards where the work takes place. So some of the detail will be there, but I think we'll continue to build on and develop that strategy group with housing partners.
Thanks, Claire. John, I know you spoke that took your hand down, so I'm going to come back to you.
Oh,
so
sorry. Well, that's because that's a system-driven thing. That serves me right. So you can come back to me later. I'll put it back up again.
You sure? In that case, Carol. You're on mute, Carol.
Sorry about that. I'm worried about the shift in the balance of care from hospital to community, and quite a few of my constituents are worried about that, and they're worried about the recruitment and the retention of staff in order to achieve what they might need when they come out of hospital and go into care.
I think we all recognise that, Carol. Claire, I think that the plan has to encapture some of those issues, particularly around staffing, and I'm sure we'll pick those issues up as we go through the consultation. But I think it's, I'm not trying to take anyone else's words here, the staffing issues are going to be a significant challenge to us over the next 5 years in this. Okay, I'll move around the table. Lynn.
Thanks, Andrew. Just sort of taking Siobhan's point a little bit further, and as a housing person sitting around the table, although I'm not sitting here as a housing person, obviously I'm aware that there's various contributions from IJB into local authority by way of local housing strategy and stuff. But I think one of the areas where we can best seek to try and influence is around Local Development Plan 2. So that's a process that's going on at the moment. So Claire might be able to give a nod to what that link might already be, but I would ask all IJB members to be mindful of that and take whatever opportunities we have to try and make sure that we're feeding in the right information around ageing population in particular, and that need for prevention to be far more about how someone's home can provide a safe space for them, much better than us being able to respond to falls and what have you afterwards.
Yeah, valid point, Lynn. Thank you. John.
Okay, yeah, thanks, Claire. I think this is a really good start, actually. Quite straightforward to read. I mean, I did sort of triangulate our existing 7 objectives into these 3. And I think some people would, well, I think I probably prefer the way you've done it, which is 3, because it's sort of easier to remember and sort of work with. But I felt, and it's not a big problem, but really what we've done is we've compressed the priorities of the 7 into the 3, essentially, because when I triangulate them, I can find pretty much all of them in the 3 in his paper. I'm not saying that's necessarily a bad thing, but I just want to make that comment that maybe it's a good thing because there's nothing missing maybe from the existing strategy in terms of consistency. And that when we talked at the last IJB meeting about this being probably an iterative strategy rather than rip up the existing strategy and start again. So I think, to me, that sort of makes some sense. I think it's secondly, I think it's important where we can, and we've sort of done that a bit in the paper, is that this needs to be, setting objectives needs to be around quite evidence-led, data-led in terms of the why. Why are we doing something? Why are we transforming? Why is it about this? And I think you've got some of that in here, talking about a growing population, aging population. Personally, I'd kind of like a little bit more on that side of it, rather than jumping straight to the objectives, but that's just a personal preference. And then I think my major question and comment is really around, it'd be really great to understand much more about the feedback you've had since February in the paper and your discussion. You mentioned about feedback we had with all sorts of stakeholders since February, and I really appreciate, I think for us, for the IJB, to hear more about that. This may not be the forum for it because, you know, limited time, and I don't know if there's a paper you can put together without making work for you to give us, to let us know who you've spoken to broadly, who, you know, what's the major feedback is. And I'd be particularly interested in finding out what the feedback is from the other IJBs you've spoken to, maybe West and Mid in particular, maybe less so Edinburgh, because I really think we keep on coming back to this, don't we, about linking closely with sort of partners, as it were. And you mentioned NHS Lothian, and I presume you don't, and obviously you'll have talked to the council as well. And so for me, that's the bit which I'd really be interested in finding out more from you and the team, because otherwise we're kind of jumping from February to now, where with the paper is sort of going straight to objectives. And I think to help us, some of us who haven't got that insight that you've got and haven't been part of those discussions, it'd be really good to understand those discussions, if nothing else, to understand a bit more about optionality for us. And what are, you know, we don't know what we don't know in terms of options and different approaches and different ideas. So that was kind of my, I guess, my main comment, Andrew and Claire. Thank you.
I think, thanks, John. I don't think we have time today to go through the detailed feedback, but Claire, do you just want to give us a flavour of that and let us know how we'll get all of that stakeholder feedback? Because I like John, I think when we come to be making decisions, we want all of that awareness in front of us as we go through the final drafting of the plan. So Claire, come back, please.
Yes, so I'll come to the data point first that Jonathan made. So we are currently developing a joint strategic, well, the joint strategic needs assessment is in its final form, just to be signed off, and that contains much more detailed data on demography, population health, and so on. So that's a really useful resource, and we'll be making that available as one of the part of the engagement materials. We'll also, as we develop the consultation draft, we'll incorporate more of that information there. So this was really today's, what we're presenting today is kind of high level stuff to sort of really just to get steer from the IJB on whether the direction we're suggesting is the right one, and these kind of high level messages are the right ones. So that's on the data. In terms of engagement, so we've captured all the engagement currently is captured in a spreadsheet, and we pulled out the themes. There was a development session with the IJB, I'm not sure when, last month, the month before, and there were slides on the themes that were coming out from the engagement. So reassuringly, it was quite straightforward to develop, maybe to identify 6 or 7 main themes, and then the detail under that as well we'll continue to look at as we kind of work up the consultation draft. I'm hoping we'll continue to do that, continue to capture the engagement feedback and to process it in that way, and further down the line we'll present that in a format that people can understand and get a sense of what the common themes or the ongoing common themes are. Also on the engagement information, I think this initial stage of engagement, so in the first months of this year, so it's January, February, March through to April, it was more on sort of the general high level themes. I think as we go on that changes a little bit because we're structuring the engagement according to subject agreement from the IJB on these 3 key objectives. So that'll change the flavour of engagement, I think, and perhaps make it easier for people who are not so close to the subject matter to engage with it. And Jen and our colleague Kate Formback, who I don't think is on the call today, are helping with the engagement side of things. And there'll be resources online and so on. We'll go out to existing networks and make use some of our stakeholder contacts that we have in place already.
Okay,
John, do you
no,
wanna-
I think that's I think that's good, Claire. I mean, I get that as a process. I guess at this stage, I'm trying to think, you know, maybe it's more useful to understand where there are stark differences in opinion in terms of the direction, perhaps. I mean, I don't know if there would be, or has been, but just it's kind of, again, that's optionality. I think even when you go to proper consultation, we're still sort of directing people down a certain path, I feel, because you're naturally going to use these to direct that consultation to a degree. So you're kind of leading it. It's just interesting, you know, is this what we're seeing here? Broadly a consensus, really, from what you've put in terms of your discussions, is, you know, and I'm not trying to put you on the spot and think of all those discussions, but just broadly, when you sort of reflect upon the discussions you've had over a number of months, and I appreciate the nature and context of those early discussions, you know, is this broadly what you're hearing out there with the people you've talked to? Does that make sense?
Yes, so just to come back to it, so the engagement that's taken place so far has involved people who are fairly close to the subject matter. So it's been SPG, IJB, senior management team within the Health and Social Care Partnership. So it's people who are already quite familiar with the whole health and social care integration agenda. So it's not surprising that there's a little bit of sort of confirmation bias in there. I think we'll see that'll be quite different as we move on to the next stage of wider public engagement over the summer and into the autumn. And I think that's where we're likely to get more divergence of opinions, which we will capture and come to some sort of position on. And that's the difficult bit. As you begin to get more divergent views, that's when it becomes more tricky, and it gets to the point where it needs discussion and decision rather than, yes, I think we all agree on this, which is where we're at the moment.
Okay, understand. Thanks, Claire.
I think it's a huge challenge getting who is the average person to give a response. I mean, it doesn't exist, and starting with a blank piece of paper, then we will have a whole series of views. I think we have to follow the people who are expert and skilled and knowledgeable in this field and be guided by that. But I think that's a valid conversation. I'm seeing no more hands, but I just want to check with Fiona, Chief Officer. You were quick on the draw there, Shameen. So
well,
please.
I'll let the others come in. I'll come in last.
I was going to ask Fiona to summarise at the end, just her take on all of this, and from a chief officer point of view. So please come in, Shameen. Yeah,
no, I just think when John, you'd asked around what are people going to think and what they're going to say, and Claire, when you said the views might be divergent, but I think as a strategic objective, I think the shift in the balance of care. But then in the narrative below that will help us to transform and change service, because the way it comes across now is that if we're asking people to transform the services that they're currently delivering, and there's lots of service managers on the call, I think that'll be a really, really difficult, challenging ask from them, unless there is a shift in the system where you are seeing more resources being ploughed into community services, and that's a clear message we're hearing from government in a lot of those 4 documents. There was a meeting of chairs and vice chairs of IJBs with the cabinet secretary, and he was very clearly saying, you know, people in the local community and local services, that's where we want to see more of that prevention, early intervention, and tackling that locally, because we tackling the other health issues are difficult and challenging, but we have to have more of those local community-based services. And I think the way is at the moment, it looks like, well, we'll transform what we've got, but that's, I'm sure service managers pass on their feedback to you, but members of the local community that see those services and they see how difficult and challenging it is for frontline staff, that if we don't see that change, it's going to be very difficult to transform.
Andrew, can I come in there as well?
You may. It's
Yeah,
important we
Andrew,
have this conversation. It's really important. So
no, I think this is really, really interesting, Shameen, actually, what you're talking about there. And just add on a bit, so it may well be that the language is quite important, what we use here, clearly. And using the word transformation and change as our number one objective is an interesting one in a sense, because when you read the detail, you've got the points you made there, Shameen, but also, is it really transformation, or is it really just an iteration and kind of just improvements? And I don't know. And it's important people with the word transformation is bandied around nilly-willy at the moment. It really is. Everybody's using that word. But is it really, what do we mean by that, right? And I think we do need to reflect and think about that as this process continues, because I don't know if that's what we will have as objective number one going forward. I don't know. I'm just, because I'm really interested in that conversation and comments from Shameen there. And I'm not saying we should, obviously it's just a draft. I think it's a good draft, but just, it sparked something. And when I was reading as well, and Shameen's comment there about the word transformation and what we're actually doing, that risk of expectations being a little bit higher than the results will be, kind of thing, so overplaying our hand a bit, but at the same time doing what we need to do. I don't know, it's an interesting area. I'll leave. Yeah, thanks, Andrew.
Yeah, Claire, do you want to come back?
Yeah, I think it's a really good point. And I think we look properly at the service renewal framework that the Scottish Government's just published, and I think the language used there is possibly something we might lean into, because I can understand. Yeah, I understand why the term transformation. It's one that we've used previously, and we've had transformation projects and so on. But maybe we do need to look at that language, and as I say, try and reflect perhaps more of a sort of national strategic language that's taking place at the moment.
Thanks, Claire. I am seeing no more hands, so I will try again. Fiona, do you want to give Chief Officer take any things you want to come back on for this? And
yeah, no, happy to. And thank everybody for the comments. I'm content with the way it's progressing, and great to get this level of discussion. I suppose I'm just thoughtful around the engagement, and that's something that we've done well in East Lothian around big issues, how we engage. So I'm confident around that process, and keen though to work with people, because I'm very thoughtful, particularly around local councillors and others who are out and meeting constituents. And as you take your wheelie bin out, I want to make sure we are helping you around that language. And Carol, I'm just picking up around your concern around shifting the balance of care, and how do we help with that? Because actually we've made great progress, even in the time of the iteration of the strategic plan, and even in the last 6 months, with the investment around discharge to assess and care at home. We are sitting with beds in the community hospital empty. We don't have health delays. We're supporting people in ways that we couldn't before. We're preventing people going in. So again, how do we allow you, as all of you as IJB members, to feel confident and feel close to what we're seeing day to day as part of this plan going forward? So I'm thoughtful of kind of joining the dots, particularly when we're having conversations about this, to give confidence that it's the right thing to do around that shifting, but as well, I guess, give you that assurance. So I'll pause there. Thank you.
Thanks, Fiona. I think it's a really important piece of work, this. So I'm going to come to the formal recommendations. There's 3 there: to note progress today, to consider the draft strategic objectives, and to give some feedback that we've started to do today, and to approve the strategic objectives and delivery priorities as the basis for the wider engagement. I'm taking that most people are content and happy with that. I'm seeing nods and things. So Claire, thank you. We will be revisiting this many times over the next few months, but I think that I think the timescales and the plan and everything in there is exactly where we need to be. So thank you. Okay, we move on to agenda item 6, which I think, Claire, is you again, which is directions.
Yeah, thanks, Andrew. So this paper relates to a review of East Lothian IJB directions. So it presents recommendations regarding the 2025-26 IJB directions. It's based on a review of the existing directions and reflects updated budget information for the current financial year. So recommendation is to continue with our existing approach to directions, whereby we've got a set of core directions. That's the first part. So these reflect the requirement that all of the IJB delegated functions need to be covered by a direction. So basically they instruct delivery of these functions by one or more of our delivery partners in line with the IJB strategic objectives and utilising the allocated budget. The second type of direction we have within the set is specific directions. We're calling them for want of a better term, but these are a mixture of historic and more recent directions that have been issued in relation to IJB decisions. So they give instruction to, again, either one or both of our delivery partners in relation to how IJB decisions will be delivered. So they are shown respectively in Appendix 1 and Appendix 2. So in terms of revisions to the existing ones, for the core directions, the recommendation is to retain with just a number of very small changes to the text and the addition of the budget information for the current year. For the specific directions, there's a number of recommendations and they're shown at paragraph 3.4. And that includes the closure of 2 directions because activity in relation to them has been completed. So the final point just to highlight is as part of our IJB directions policy, we continue to actively consider whether new or existing directions have to be amended throughout the year. So it's an ongoing process. We revisit them annually to update them and make sure they're still relevant, update the budget information, but it is part of an ongoing process with directions. And recommendation is IJB gives active consideration of issuing or revising directions.
Great, thank you, Claire. So we'll take that opportunity to open it up to conversation, comments. Tremaine first.
Thank you. Claire, I just wanted to ask on section on engagement. Could you say a little bit more around that? So this has got some other steps after today around engagement with programme boards and other groups. Does that sound right?
Sorry, I lost my microphone there. So the programme boards, the directions will be oversight will be by the programme boards, and the ongoing review and recommendations in relation to directions would come from officers or from programme boards. So that's kind of the ongoing engagement process.
Okay.
Jonathan.
Yes, I guess for me, I mean, I guess my question is really just about the practical effect of directions and just understanding a bit more about what this means in practice for officers in terms of liaising with NHS Lothian, liaising with the council to ensure that these directions are enforced, as it were, and as etc. And because some of these are so high level and vague, I struggle to sort of understand kind of the impact of them and what the purpose of some of them are. But I know it's a really important part of the governance piece between IJBs and the 2 parties. But I'm just trying to understand a bit more, the day-to-day. How do you liaise with the key counterparts within NHS Lothian, the council? How is it monitored? How often is it monitored? And just to give us some assurance around that there is a rationale, of reason for having these directions, I guess, beyond just it's part of the IJB, construct.
Good luck with that one, Claire. Go on.
So it's part of the IJB construct. I guess they underpin the ongoing discussions with our delivery partners, and should there be anything challengeable or needs to be a discussion, we can revert back to the directions. I think generally the ongoing partner meetings that we have and performance monitoring and so on feeds into the directions, but in large part it's part of the governance structure, is there where you need it, and generally a continuation of operational activity goes on, but could go back to the directions for clarification or challenge if needed. That's the best I can say. I don't know if anybody else is better versed and can comment. Thank you, Mike.
Do the relevant parties on NHS and council side, to what extent are they actively looking at these when we deliver these to them and coming back with questions and going, right, you've changed this, you've done this, let me put you in touch with the, I don't know, relevant department head of XYZ or whatever. Is it, I'm thinking of the practical part of this, not just this being paperwork because of the IJB construct, as I said. I'm not trying to be awkward. I'm just trying to understand it from a practical perspective, and the importance of it to us as an IJB in improving them. Like, how much governance do we need to put into this to really understand these, to help you, to approve these, etc. And so it's a sort of just a practical question, really.
So these so obviously we issue them to the chief executives of our partner organisations, but we're also taken to the partners meetings. So that includes the chief executive of the council, NHS Lothian, our chief officer, our operations manager, our chief finance officer. So the discussion takes place there. And prior to the directions being issued, we go to the partners meeting as well. And I'll hand over to Mike to tell you more, hopefully, or Laura.
So Mike first and then Laura. And
I guess I was just going to comment in terms of the finances, Jonathan, and the fact that they are part of the directions, I suppose, is a way of us conveying to our partners in the Health and Social Care Partnership how we want them to spend the money that they are giving us. So if we were to change things significantly and decide that we wanted to invest more in community care in a council service rather than a health service, and we wanted to direct some of that money in that direction, then we would be able to do that. At the moment, what you see is most of in fact, almost all of the money that we get from our partners going back to the services that the partners delegate to us. But there may be opportunities as part of the strategic planning process that we go through and implementing that and achieving some of our aims, where the money from one partner is spent in some services in the other partner's domain. So I suppose that's one of the reasons I think the directions are quite important, and it gives us that clarity around how the funds will flow.
Laura, do you want to add to that?
Yeah, just super quick then. I suppose it's just remembering that the delivery groups and the programme boards will send those new directions, or you'll see in all the reports, how does this link to the directions? So you see that in all your IJB reports and your SPG, and it's for the SPG to have that discussion with their partners who are present at the SPG. Okay, are we agreeing that this direction is what we're doing, and the partner's happy with that? And that's the significant role of that strategic planning group, is to, yep, we're happy with that direction, we understand it, and we will monitor it through the SPG and the IJB. So yeah, we were asked last year, I think, to do a presentation to the council's chief exec on directions and how they were, how we made them, whose responsibility was it, how we ensured that we delivered on them, and how we made changes to them. We will do probably a similar one to the new chief exec of the council again, just so he is aware. But yeah, it is that responsibility, and I am comfortable that if the strategic planning group are doing the right thing and doing their jobs, they will see it and they will challenge on, this direction doesn't make sense, or we made a direction, we don't see any work coming through from it. So it is helpful to have it as and I think it is yeah, let's just reflect back that we should always be seeing in your papers that you see coming through, look to see what direction it's referring to. And does it really do that as a direction? I think that's always helpful.
Good difference from colleagues as to the process there, and helpful to us to understand that as well. So, Shameen?
Yeah, just it's a helpful document. Might be useful just if we're doing future papers, that paper refers to which direction. And I'm also kind of mindful of some of the things around the housing for particular needs. And so some of these things might not be within our gift. It might be as a result of external resource or allocation, we can meet a housing need or we can't. So I'm just cognizance of that as well, that some of those things are out with our control, and that if we are able to meet all our particular housing needs, that's great because we've been allocated the level of resource and need it. If it hasn't, then there's some way of noting that as a result of X, Y, and Z, because some of these things are going to be a bit out of our control.
I'm pretty sure, Laura, that all of our papers have a set section that says, how does this paper relate to which particular direction? So I think we're already encapturing that within the papers, but I think Shameen's point is still well made.
Yeah. Okay. And just remembering that we only give a direction to services that are delegated to us, so we can, yeah, the housing point is well made. We wouldn't delegate down to housing, the number of housing like we did before. We would just delegate, okay, this is the services we want to deliver in relation to housing.
Okay, I'm seeing no more hands, so let me just get to the recommendation bit. So we have considered and we have been asked to approve the directions that are in 1 and 2, and to note that active consideration should be given to the introduction of additional directions as and when required. I'm more than content, Claire, that the ones that are closed and we take them out. Let's not keep things in just because they've been there for all over time. So I'm more than happy, and I'm looking to voting members. I'm seeing nods and things, so absolutely fine. Thank you for that, Claire. Yeah, you can have a break now. So we move on to agenda item 7, which is Mike, who's going to take us through our draft brackets unaudited annual accounts.
Thank you, Chair. Sorry, I had a bit of trouble getting my microphone off there. Afternoon, everyone. So this paper presents the IJB's unaudited draft 24-25, sorry, getting ahead of myself, 24-25 annual accounts to the board. And we seek agreement on from the board that they can be submitted to the auditors for their consideration, and that we can publish them on the IJB's website as we are required to do. So the IJB has to follow local authority convention in terms of preparing its annual accounts, and the paper includes 3 key stages in that process, and it provides a brief summary of the main sections within the annual accounts. I'll just briefly take you through some of those. So they include the management commentary, which gives information on the purpose and functions of the IJB. It highlights some of the work and the key successes across the IJB in the year 24-25, and it provides a brief summary of the financial performance. The accounts also include the IJB's Chief Internal Auditor's annual governance statement, which was approved by the Audit and Risk Committee at its last meeting at the start of June. And it has a range of financial statements setting out the IJB's financial position for the year 24-25. So in recommending the IJB approve these accounts for publication and submission, I'd just like to thank finance and performance and planning colleagues across the partner bodies for their help in pulling together the finance and performance information within very tight timescales. I'd also like to confirm that these draft accounts have been recommended by the Audit and Risk Committee for approval by the IJB, and that I will bring back a set of final accounts to the IJB for sign-off in and around September time. Thank you.
My microphone was on mute then, so it's a common theme today. So I'll open it up to any comments. I think we take recognition that this has been through a process through Audit and Risk Committee. So and Audit and Risk are recommending that these are accepted. But John.
Yeah. I mean, it's sort of hard to. Yeah, Mike. I guess for me, it's a bit hard to kind of make the judgment you're asking for, because normally. Maybe this happened last year, or was it before I joined the IJB? Because it sort of feels that normally you would have had this audited and then it comes to us for approval. But this is the other way around. This is basically saying unaudited accounts, and we have to approve them, and they get published, and then later on it gets audited, and that feels slightly odd and exposes us a bit as IJB members. I have no way of determining whether these numbers are at all correct. Obviously, as a member of the IJB, I appreciate Andrew, but it's gone through Audit and Risk. I don't know what Audit and Risk have done to assess the veracity of these accounts, but I can make some judgment call on that process. So I don't know. I'm not disagreeing this. I will vote in favour of this just because you presented it, and if you give us assurance that it's gone through a normal process. I feel that piece of the audit piece. So external. This hasn't been subject to any external review. This is. This is an internal set of documents. For us to publish it and to make it public seems slightly odd in the sort of governance process. Am I sort of wrong in thinking how this should work? And this may be always done this way, but I still think it's a valid question that I can ask.
I'll let Mike defend his position and the position of the system that does it this way. Mike, good luck.
Unfortunately, that is we are bound by process, and I'll be honest, John. I honestly don't know what the reason is for it being a requirement for us to publish these. I presume because of the nature of our work and the fact that we have a role within the communities and everything. It gives people an opportunity to see what's being done by the IJB and to potentially comment on it. But yes, it is a strange way to do things, but that's what the requirements are, that we bring it through this process through Audit and Risk and then through the IJB, and then it goes on the website, and then the auditors will have their role in assessing the accuracy of the accounts and the content, and then pass their comments on that, and then it will come back for IJB to approve as a final set of accounts. So I'm sorry, it's maybe not a great answer, but it is the only answer I have at the moment.
I also think because we don't carry cash per se, so
no,
the accounts of both the council and NHS Lothian have been audited. So I think there's some safeguards within that as well. So, I mean, if is this a double, triple?
I agree. I think that is a point. I'm not sure if I agree that's especially relevant for the question we've been asked here.
No.
I'd be interested in finding out maybe from the Audit and Risk Committee, what work was done, because again, you can see I'm pushing here a little bit to get assurance on how to approve it when we don't have that external review, and I don't know how to kind of review it properly, and what we've really truly been asked to agree. And it might come down also to what is really published and what the caveats are around that publication. Which I'm sure will say unaudited set of accounts, right? Yes. And maybe that's enough to get us over the line. But I still think just being a little bit cautious on your wording of what you're asking us to do here. But I'd be interested in what Audit and Risk have done in terms of their review process. That would provide some assurance to me.
Tricia, I think you're a member of Audit and Risk. Do you want to respond to John on this one?
Not especially. I think your questions are valid, because to me, I'm still very much learning the process about this. So I think to me, this is a learning process. And yeah, but I think we were guided through it at Audit and Risk. So yeah, I was certainly satisfied at the time. I'm busy searching in the background for the minutes of that.
Thanks for trying, Trish. Laura.
I'm sorry, I'm not very good there.
No.
So I'm just wondering, just based on, so what the IJB are being asked to do is to consider the IJB's draft unaudited annual accounts. So you just need to look at them and consider them and ponder over the accounts. And then the next bit is to agree that the draft annual audit accounts can be published and presented for audit. So you're not agreeing the accounts, you're agreeing for it to be audited, I think.
Yes.
So was that better?
You've stolen my
Jonathan, you're
thunder.
on
That
mute,
was my
which-
final comment. I was going to come back to Laura, but thank you for getting in there.
One step.
Ahead.
So it's one step before. It's a one step before approval. It's basically have a look.
Yeah.
Any comments and then kind of
Yeah.
publish them. I guess then the question then is what is the what's the response? So that is the responsibility. If there's a material error which we have not spotted because the governance process is not, and the review process is not
But
finished.
that's okay, that's for audit
then
to
that's
spot
fine,
your
is it?
errors. Well,
Yes.
audit are there to tell you you've done it
Yeah.
all wrong, and then we can bring them back and say, oh, you didn't consider them well
Yeah.
enough.
Okay, we
Right.
didn't invent this process. We are subject to it. So
but that's not. Yeah, I understand that, Andrew. But I think I'm trying to be clear what we're really what our role is here in this process, and I think now I do understand it. I'm not sure. I cannot agree. I don't think I can agree with that process. But then it's not for me to. Clearly, it's not something that's going to change. But sometimes just because something has been done this way forever doesn't mean it can't be challenged, and maybe we want to go back and challenge this in some way rather than just accepting it. If we as an IJ believe there's different ways of doing it, I don't know who sets these rules just because it's always done like it. But anyway, I'm happy to do it on that basis. We've considered it and we've said okay, publish them unaudited, subject to audit, then fine by me. But I'm just sorry to be a bit awkward. I'm just trying to be clear what we're trying to agree here.
Okay, thank you for that. So let's come to then. I'm seeing no more hands to the, as Laura just said, the recommendations is that we have considered them and we are seeking agreement that the draft can be published and presented for audit. And I'm seeing enough nods and confirmation of that. So we move on to that process and we look forward, I think, to seeing the audited accounts at some point and hearing any views from audit on those accounts. So thanks, Mike. We'll move on to agenda item 8, which is the Carers Strategy Year 2 update. And I think Maria's going to talk us through this paper.
That's right. Thank you, Chair. I'm just going to say I'm joining a development session in August to look a bit more in depth at the contributions that unpaid carers are making and the kind of issues that they're facing and any changes that are coming down the line that are going to impact them. And this will feed into the development of our refreshed carer strategy, which is due in 2026. But just coming along today to give the Year 2 update on the progress towards outcomes in our current carer strategy. So I've asked the board to note the contents of the paper and most of the detail is covered in point 3.4. But just to highlight a couple of main points, if that's okay. Carers based Lothian, so they're our adult carer support service. They were successful this year in securing the contract for their adult carer advice, information and support service for up to 6 years. So this has been really positive and will bring loads of sustainability for local carers and continue to provide that kind of one-stop shop that carers have been asking us for. They're currently providing active support to over 1,500 carers every year. East Lothian Council's Young Carer Service now has over 700 registered young carers. That has been a really fast growth over the 3 years that they've been operational, and they continue to offer a really wide variety of breaks over holiday periods in particular, aiming to offer young carers the chance to enjoy the same opportunities as their peers. In Year 2, we were able to support a number of projects delivering support to carers and looking after their own health and well-being. Well-being has been a massive priority area because we did some consultation on our local eligibility criteria, and it really highlighted that the impacts of caring around relationships or finances or all these different areas, they all add up to give that impact on health and well-being, and ultimately the carers then ability to continue to provide the support that they're offering. Our other priority area is breaks from caring, and this will be given even more emphasis with the plans that are coming for the right to a break, which I'll cover in a wee minute. But in East Lothian, a significant amount of the Carers Act funding that comes to us is invested in expanding availability and range of breaks. However, evidence does tell us that carers really struggle to access the breaks that they need, and that more work is needed to ensure that our short break sector has the variety and the capacity to meet the diverse needs of our carer population. We have continued to work to maximise carers' voice through many different channels. We are ensuring that carers are heard in service planning and development. Carers of East Lothian have a really active carers panel, and our young carers service have a young carers advisory group, and their voices are definitely getting stronger as they grow in confidence, and they're taking forward their own issues that they're bringing important to them. So that's a kind of summary of the main outcomes. As I noted, the other part that I just wanted to highlight is in relation to the introduction of a right to a break that is coming. You'll probably have seen that the Care Reform Bill passed on the 10th of June. And one of the main aspects of that bill is to bring into law unpaid carers' rights to a break. And this is something we'll be exploring further in August about what that means and how we'll prepare for its introduction, but potentially bringing some really big changes for us and duties on us as a health and social care partnership. And I'll stop there.
Brilliant. Thank you, Maria. It's a comprehensive report as well that I took a lot of confidence from reading that, the full report as well. But we'll open it up to questions and comments. Janine.
Thank you. Thanks, Maria, for the report. I've got a question, and then I'll just kind of follow up with a comment. The question was around, just following up of what you'd said around a break, and you're absolutely right. And the number one area that carers raise is having a break or respite. And there's a section in there about increasing availability of bookable residential respite to give break to carers with a care home link officer. I just wondered what else do you think the IJB could be doing to help and support especially the new care homes, to be able to provide more residential support, and just to get an idea of what's happening in other places. Are they having kind of similar challenges around providing respite?
Yeah, so I think that's absolutely right. We do struggle, and we have, as you're saying, just the one bookable bed at the moment. But I think one of the issues is that the care home providers in the area, most of them are private providers, and really we don't have a lot of influence over whether they take on bookable respite or not. Our care home link officer, as you said, continues to have that conversation whenever there is a new provider or as part of that contract monitoring, and we are exploring options with them. With a new provider in Haddington, and we have been working with Lukey. We did something through the Carers Programme Board recently for them to do a scoping exercise around development of a kind of dementia specialist respite service. So we are working towards that, but in terms of the IJB, I'm not sure that we have a kind of power to make homes provide that offer.
Okay.
Thanks, Maria. Patricia?
It's again kind of continuing Shamine's theme there. I think the thing that worries me is also the take up of even if the respite places and having a break is available. One of the reasons people often don't take up these things at any age is because they don't necessarily have confidence in the provider. So I think that's one of my concerns. And there are lots of admittedly anecdotal stories about the person being cared for going into whatever other arrangement is being made for them, and then they come out and the original carer has to pick up all the pieces, and that applies to whether it's a young carer or an older carer. So I think yes, please to more availability of breaks and respite for carers, but it has to be of good quality, and not just good quality as judged by committees and things, but good quality that people on the ground and the carer has confidence in, because you're not going to take something up if you think things are going to be worse when you come back.
Yeah, and I think one of the things we've been discussing as well is about that, the right to a break will be very much about that range of breaks. So in improving people's confidence in taking short breaks and short amount of times away on a regular basis, not being completely focused on that kind of residential respite. Obviously that is necessary and it's part of that full package that we need to develop. But we've been thinking
Agreed.
about health and well-being and outdoor adventure groups, all these opportunities that really support
Yeah.
carers rather than just
Yeah.
looking at those kind of services.
Thank you.
Isabel?
Yeah, I mean, one of the things we're looking at is just getting feedback, is collating feedback in general. And one of the things, I don't know whether you're already doing this, Maria, but if not, we can discuss is just getting that feedback from carers once they've used the care home. Just touching with your point, Tricia, and whether or not where it has left them after they go and the person returns home. So that might be a way of kind of getting that feedback and getting that in terms of quality if you don't already do that, Maria.
Yeah, that's something we've been discussing with the community care worker, that is particularly in relation to carers, that especially in relation to Haddington, where we do have that block booking, that we follow up with everyone that uses that service to get that feedback, and then the link officer kind of picks it up through her contract monitoring. So confident we've got it in terms of that one bed, but also that carers are accessing lots of different services and we maybe don't have the feedback more generally about their experience of other services they might be using.
We can get that. We can look at that.
I would have not tried to have brought David Binney in, but he's on holiday here, so unfortunately. But I'm sure David has contributed to this significantly. So, Shameen?
Yeah, just thanks very much, Maria, for that feedback. And it's looking at, I suppose, respite and carers break in the kind of widest possible sense. That my other one was on page 117 around the rehabilitation service, the new direct referral pathway for carers to access an occupational therapy assessment in their own home. And you might be able to cover that in a bit more detail in your development session. I don't know if yourself or Leslie Berry want to cover that, because that would be a really valuable support for carers. And I don't know if it says it's got a vacancy, and I just wondered how you'll be managing that and what you plan to do to address that.
Yeah, so we can certainly give a further update in the development session if you'd like. That position is no longer vacant. We have someone in post, and Leslie can give more information as well. But they're looking at ways to develop their server to offer that, because there's only one person, to more people. So they're looking at ways of offering group training and intervention at an earlier stage as well. So that is a pathway that's really unique to East Lothian and we're very proud of. So yeah, we can give some more input on that.
Thank you.
Leslie, do you want to come in on that point?
No, just exactly what Maria was saying. We found it's a hugely valued service by the individuals, by the length of the waiting list. However, we're motoring through that now. And yes, as we said, it's attracted a huge amount of professional attention internationally and through the UK. So yeah, we'd be delighted to work with Maria on that when we discuss it at development session.
Okay. John?
Yeah, thanks, Maria. Yeah, such a massively important area, obviously. I guess that's just for me, from a knowledge perspective, just the right to a break and kind of, if you could just explain to me what we're doing at the moment, or how extensive is it in terms of providing a break for carers that we in East Lothian at the moment, right? I'm not sure. I don't really understand that very well at all. Do we? To what extent are we already doing that, and kind of in what form do we do it? There was a mention of in care homes, etc. But I'm talking about kind of carers at home. You care for your husband or wife, and then you need a break. And then to what extent can that individual get support from us already? I'm sorry, maybe others have. This is a basic question, but I just don't know how extensive that is at the moment for us, that offer.
Yeah, so there already is quite a range of supports in place to kind of offer breaks, but I suppose the more formal ones that come through social work. So when we're talking about replacement care, either in terms of someone spending time with the cared for person so the carer can have a break on a short-term basis or on a residential basis, that is all through an assessment process, and it is very much a substantial and critical need. Whereas in the community, we have an awful lot of services that offer respite. So Carers of East Lothian have a Time for Me programme, so they give grants to people so they can do small activities and stuff for breaks. But also we have we invest in Lukey is one example, our older people's day centres, Community First through Volunteer Centre East Lothian. But these are all universal supports that are open to anyone. So there's a lot out there, but only the ones at that substantial critical bit are the ones that come through us, and would have budgets allocated in terms of those breaks.
Can you just give us a sense of size? Right? I mean, I don't know. Do you even know roughly how many local carers there are in East Lothian? Therefore, of that population, how many actually are eligible to get a break already? Just to give us a sense of how big a issue this is going forward if the legislation changes.
Yeah, so I suppose the number of people that identified through the national census in terms of unpaid carers in East Lothian is just over 13,000. So there will be a significant number of people that have caring responsibilities in the community. In terms of those, I think that's going to be the thing that they have to establish while they're looking at this term sufficient breaks, which is what they're talking about this new legislation. How do they define sufficient breaks, and how are we going to assess whether someone is getting sufficient breaks? At the moment, I think we're aware that there are, I don't think we have an exact figure on the amount of kind of like in terms of finance, in terms of how many breaks we're supporting, but that is something that we're working on in terms of our reporting, and to give us a much more accurate reflection in terms of replacement care in particular. But it will be that full range and all those community supports as well. So at the moment, at Carers completes what's called an adult carer support plan, and that will look at their need for a break, and that's the new bit that's going to come in, that if we agree through that assessment process that they're not getting sufficient breaks, that we will then have that duty to provide them. So I think there will be an increase in demand for sure.
I think from your answer, am I wrong in saying a very small proportion then of that 13,000 actually get there, and therefore I don't know what modelling is going on right now. I mean, I'm sure that's possible to work out, depending on where the direction of travel is on the legislation, what not just a cost impact, but a staffing impact this is going to have on us if we are to comply with that duty. Is this, am I underestimating this issue? I mean, is this really the big issue for us when we're thinking of this area? I mean, if nothing else, Mike sitting shoulder to checkbook, if he has such a thing, this seems like an enormous issue waiting to happen. I know that this legislation, I don't know when it comes in. I can't remember where you said it would, and no doubt it's phased. But if we are going to have a duty to comply, then it's really interesting as an IJB to start to think about that and understand that and have some clarity, I think, for us in terms of what might be coming down the pipe.
That's it. So there's a financial memorandum that was attached, and the kind of upper estimate was up to like 315 million that would be required by 2035 to implement this. But there's obviously not a commitment to that at this stage. So there's an awful lot going on for them in defining sufficient breaks to start with, and then how we're going to assess and what that duty will mean for us. So quite a lot of uncertainty at the moment. But yeah, something we're just bringing to raise awareness because, as you say, could be potentially huge.
Okay, thanks.
I think we're going to be carefully watching this space, as with all things. When a piece of legislation comes in that says we have a duty to do this, we have to add that to the availabilities of the monies to do all of those things that are potentially statutory. It's going to be, however, it's the right thing to be doing from everything Maria's just spoken about. Shameen?
Yeah, it was just more of a comment just to thank Maria for her leadership in this area of work, and especially all the social work, social care and health staff that support carers. But I think mostly of all, I know Jess Wade is no longer at Carers of East Lothian, and she's got a new job. And just to thank Jess, because we wouldn't be able to provide that level of support and the outreach work and the breaks, John, that you've talked about. They provide a whole range of different activities and breaks, kind of the widest sense possible. We wouldn't be able to do that ourselves. So I think it's just an example of when we've got a community partner that's helping us to deliver that support for carers in East Lothian. They've done an amazing job. And out of the 1,500 people, Maria, you'd mentioned 600 of those were new to the service, and also that things like having a hospital-based carer support worker and supporting people in hospital. And what I noticed from the report is that from the respite breaks, East Lothian was the 4th highest number of breaks in Scotland. So you can tell, we know that John, the level of demand and need is high there. But I think having a good partner, good community partner to work with, and having to ensure they've got funding for the next 6 years, it puts us in good stead, because they've got a really, I'm sure David Binney would say this himself, a really good valued reputation locally of the support that they provide, and are a trusted community partner. So just to thank everybody for all the work that's gone on. And Maria recently went along to meet with young carers, and myself, my colleague Fiona Dugdale, went along with her, and I think on that day we were able to sign the Young Carers Covenant, because those young people will then move on to becoming possibly adult carers, and how we support them right from the early age. So just to thank for all the work that's going on in the background. And I thought it was really helpful to have in there of things that you said you're going to do and things that did happen. I just wondered if there's a way that you'll be communicating that in an easy format to let people know that there is lots of work going on to support young carers and adult carers in East Lothian, and it's hugely appreciated.
Yeah, I suppose just to clarify on the 4th biggest provider, I mean, that one is particularly in relation to something called Hospitality, which is about the kind of tourism and sector donating breaks. So that was something new that we did in this year, and Carers of East Lothian became a Hospitality partner, and really positive that they were up there, and providing so many breaks. So it's just another way that we're accessing breaks for carers. In terms of sharing that information, the we said we did is quite lengthy, as you say. It responds to every point, and I suppose what I've tried to do here is summarise it under each outcome, and that's what is shared more widely. But the we said we did is also shared with the carers panel at Carers of East Lothian, so they get a chance to kind of talk it through point by point. So yeah, it's not an easily digestible document. Sorry.
Thanks.
I'll take a final comment from Laura, and then we will need to move on. Laura?
Yeah, thanks, Andrew. I suppose I just want to remind everyone that Maria had 2 slots on local radio, and some reason she's not mentioned that. And obviously Carers Week as well, where a lot of that publication and that information goes out, which is so valuable. So yeah, I agree with Shameen. Maria does an amazing job. We've worked really closely with Carers of East Lothian, and that programme board and the delivery groups that will be set up underneath is a really proactive board. David Binney keeps us on our toes and is often challenging, which is really helpful. And we have a number of carers reps on there. So yeah, it's a really good piece of work that East Lothian should be rightly proud of. I think we lead the way, and we're often recognised for unique and different ways of supporting carers. So yeah, just really pleased with that piece of work and the value that Maria has brought to it.
I think on behalf of the IJB, we completely endorse those comments and everything that's been said by Shamim and colleagues around here. So Maria, thank you. And the report is for noting. It kind of doesn't seem enough, but it is duly noted, and we have the IJB is incredibly proud of the work that you and the teams do. So thank you for that.
Thank you.
So we move on to agenda item 9, which is the annual reporting schedule. I think, is Neil going to take us briefly through this?
I am, yeah. Thanks, Chair. So this paper is providing a schedule of the annual reports that should be coming to the IJB for review or approval. It came about from the integration scheme, or the reports are described in the integration scheme to say what's coming forward. And the recent internal audit that went place, there was a couple of reports that we realised weren't coming. So it was decided it'd be a good idea to put forward a sort of an annual schedule for the IJB, and to let them have a look at that, which is in the paper. I don't really think there's much else to say. We're just looking for agreement that you're happy for these reports to come on these days. We've discussed this with the Chief Finance Officer, the general managers and officers that provide reports as well, to make sure that we've got the schedule correct.
That's great. John?
I'm totally fine. The only question I have, Neil, is there actually any, sorry, maybe it was already, is there any change to previous years, or is this just the normal cadence and processes? And if it is, then fine by me.
Yeah, there's not. The only change is I think there is one document, like the Clinical Care and Governance Committee report. I don't think that's come for a couple of years, so that's included in there, and that will come forward. And it's just really standardising the reports that are coming and letting you see that throughout the year rather than them just appearing.
Okay.
Okay, I don't think we need a huge conversation on this. I think this is just recognising that. So I'm taking that we are all in agreement with this. So we come on to the last substantive item, which is the transfer of Telecare. So Leslie, I think you're going to take us through this.
Yes, I think myself and Raymond McGill, who's here from the council, are happy to answer any questions. But so the purpose of this paper came originally because of a raised clinical risk that was put across when we had a retirement of the team manager from Tech. And I'll go through all the details. So the purpose of this paper is to present to the Integrated Joint Board a proposal to transfer the management of Telecare service from East Lothian Rehab Service, my service, to East Lothian Council Communities and Partnership Customer Services Contact Centre. The recommendations here, we're asking the IJB for approval. It has been approved by the SPG, and we're asking you to approve the staffing transfer and the budget transfers, also the transfer of business administration support, and also to approve the fact that the rehab service will provide occupational therapy at the highest level of OT professional support for the continuing of the Telecare service that will sit within the council. So the background of this has been laid out in the paper, but historically the Telecare team was always based with the customer care service, but changed with integration. Since 2020, the team has been based at Penston House with Telecare team, and so they have worked very closely together for a number of years. With the retirement of Alison Thackeray, as I mentioned previously, we were put in a situation where we realised there is not particularly any courses or any training that you can put anybody on to gain the knowledge and skills that are now required to manage or to lead on these services unless you're embedded in this kind of service. Alison asked for a graded retirement, which obviously was approved, and she recommended, and her recommendation was that it would go to Raymond's team at the call centre as they had the knowledge and skills. This is probably more dominant now because analogue has changed to digital, and the old button and box, which used to be plugged into your phone, is really no longer really the way things were done. It's all digital now, and in fact the analogue will be turned off in a number of years, well, months almost. And so therefore the situation of what the equipment does is very different. And you'll see in point 3.5 that the levels of complexity now is more to do with platforms where things are based on different technical and digital platforms. That is a very technical area, none of which the rehab service have expertise in. However, Raymond's team and Raymond himself have a lot of connections to the Scottish Government, etc., and link in with all these various platforms and the legislature that goes with them, and the technical issues. The technical issues became recently, in the last 6 months to a year, become a major risk for us because of the nature of the SIM cards that are in the alarms have dropped out, signals have got dropped out from platforms, and it usually ends up with Raymond's team at 3:30 on a Friday afternoon having to phone 300 people or whatever to make sure that everybody is safe and well. So the close working of this team has led us to believe that this will mitigate the clinical risk, although we are more than delighted. In fact, we need to provide the professional link to occupational therapy. This will not change anything for any of the clients. The service will remain, and other concerns have been brought up to me about the development of tech and smart tech and retail technology. We have agreement with Raymond that we will continue to work extremely closely. We're still on the programme board, and our training will be shared with the council and Raymond's team, which we do with my staff, which is basically to do with using retail technical equipment such as Alexa, etc. And that will continue for both council staff and health staff. the finances and staffing is laid out in the paper, but we're happy to take any questions at this time. And Raymond, I believe, is on the call.
Yeah, and welcome Raymond as well. And I know Raymond did join the SPG as well, where this was previously discussed. So it seems a very sensible and eminently logical thing to be doing. But we'll open it up to any questions or comments.
Thank you. No, thanks, Leslie and Raymond, for going through that paper. Because this meets one of our strategic objectives of enabling people to stay at home safely. Because we see that happening on a daily basis. What I wanted to check was around the finances on page 163, and it's the debt. The debt of £65,000. So that's going to be transferred onto Raymond's team, and it says that efforts to secure a resolution have not been successful. So I just wondered what's been done to get a resolution to this, because this service doesn't just support our objectives, it facilitates hospital discharges, additional support to Home First and discharge to access as well. And I think in the spirit of partnership working, we need to make sure that we're not passing on a debt to a partner organisation, that we're doing everything we can to mitigate that debt. So could you maybe say what's been done to mitigate it? Because I'd be really uncomfortable to pass that on to them. I think that should be everything that we can do to mitigate that debt should be done, and I don't think we should be passing that debt on to another team for a service that that all of our partners significantly benefit from.
So my understanding is the debt has always sat with the council and is being managed by the council. And although we have looked at it through our debt committee, which is run by social work, it has always sat with the council, and the debt process is the same as any other debt process within the council. So we have worked closely with all the debt administrators in the council to try and gain as much, to reduce that debt as much as possible. We have committees where they do look at people where they can come, and it kind of gets reviewed by social work, etc., to see if they still get the equipment because they need it, because it's essential to them. So it's not as if we haven't looked at it. I think it's always sat in a very peculiar position where that debt has sat with the council and been managed by the council. However, I'm not an expert on that, so I...
Mike, Laura, do you want to come in and give some comments on that?
Yeah, can I come in quickly? Sorry, Mike. It's just to be clear, this is in relation to client debt. It's not in relation to a budget debt.
No.
So we're managing it, Shameen, in the same way we would do for the appeals. So these are people that need to have they're in debt to the council. So it's not so much that the budget has been transferred, or the debt from a budget line has been transferred over. We would be looking at each of these people individually and helping them manage a debt recovery programme in relation to that. And some people will stop getting charged because they can't pay towards the alarm, but that will then, Raymond will now feed into the residential charging group and into the appeals process and be part of that conversation. So it's not a budget debt as such, it's an individual client debt.
I do still think we need to make sure that we're working with our partners, because we're an integrated service and we significantly, it doesn't matter who it sits with, the East Lothian IJB significantly benefits from these services, facilitates hospital discharges where people would be in hospital far longer from the NHS, discharge to access and Home First. So I think I'd like to kind of see what more work's been done to support our partner organisation on that for a service that we significantly benefit from.
Okay, ask Mike to come in. Sorry, John, I think this is all linked into this issue, so I'll come back to you. So, Mike, anything to add?
Not really, just I suppose to reiterate what Laura said, but also, I mean, the council have their own teams around debt collection and billing, and they do all of that on behalf of the services that they delegate to us. So it's not something that the IJB has a role in terms of collecting debt or even billing for services. So all that is done through the council services, and that's part of the delegated functions that they have with us. There's also, I suppose, just to point out and give a balanced reasoning on it is there's an income generation aspect to this as well. So all of that will move over to the council. So you're right, there will still be a debt element to it, but there's also an income generation element, which is also going to be a benefit to them going forward.
Fiona, and then sorry, Laura, then Fiona, and then we'll go back round to the questions. So Laura, Fiona, just to
yeah, and I suppose just to, you're right, it is about and we remain having that link, and from the financial aspect, which is the easier aspect, Raymond will be linked back into the appeals process and residential charging. And in relation to health and social care and the community alarms, yes, you're absolutely right. They still provide a service, but I think what we're looking at is it's important that it's a universal service. So this is one of our preventative services that you don't particularly need a social work assessment to get an alarm. You can buy one privately, or you can come to the council. So it's important that everybody has access to these. Some people will use them frequently. Some people may never use them, and they just simply like the reassurance that it is there. So yes, it is part of health and social care, but it's also about saying and making it more accessible as a universal service, and as a service the council wishes to offer. So it's available and not tied to particularly feeling, okay, I'm very vulnerable now, I might go into hospital, I'm going to put an alarm on. Actually, this is something you could have and get you kind of on the pathway to various bits of technology that may then start to support you at home for longer. So yep, agree, we need to stay linked in, and we will, but also recognising that it is a universal service.
Fiona, do you want to briefly comment? Then I'll bring Jonathan and Tricia in.
Yeah, just on the partnership working, Leslie and myself and Caroline Rogers and Raymond and Leslie Brown, when she was in her chief exec role, this is where the conversation started because of the clinical risk. Raymond and Leslie, who work closely together, it came to an executive management team meeting as an SBAR where we talked it through. So there's absolutely Shameen, just to assure you, there's been oversight from the exec team and sign off before we even brought it to the IJB, just so that we're working together and very much focused on that clinical risk. So there's no surprises.
Are you okay with that, Shameen?
Yeah, just that the paper said that the had been flagged as a concern by the Telecare service. So how was that discussed, and what plans were put in place to resolve that if they're raising that as a concern in the paper?
I think they felt they had to raise it as it was something that was present, and Raymond might come into that. But Alison Thackeray felt we were transparent in everything we were talking about.
Yeah, part of that concern was me, just as we were writing this stuff up and thinking about it, because as the semi-outsider, not knowing the detail that we're seeing here, that strikes you because, well, something's not right there, you know. So is the eligibility for the free service correct or not? If the eligibility is correct, then we shouldn't have that level of debt running. I mean, I think in some cases this is years for some clients who have had the service, not been classed as being eligible to have it for free, but yet they carry on having that. Now, something's wrong there. They either shouldn't have the service if they're not willing to pay for it but can, or maybe something's wrong because they genuinely can't pay for it and they should have it, and then we shouldn't be seeing that as debt. One of those two things has to be. And starting completely fresh, I'm raising that and saying something's not quite right here.
Thanks for that clarification, Raymond. I'm conscious Jonathan and Tricia have sat very patiently whilst we've been around that one. So Jonathan.
Well, funnily enough, that was one of my questions as well, but it wasn't Shameen's left pocket to right pocket issue, which I assume had been worked through in terms of debt transfer, as you would do for a commercial agreement, a contract like this. And it sounds like from all concern that had already been addressed and dealt with by the parties. It was actually around the debt recovery, and Raymond's just quite eloquently explained it, and so did Laura and Leslie talk about it as well. So I equally have those concerns, echo those concerns about why we have £65,000 outstanding for this service, and I would hope that will get sorted out in time. If you're writing off costs for people, or you are claiming it back in the right way, rather than letting them continue to claim a service, important service, no doubt, if they can afford to pay. But it was really, I think generally this makes a lot of sense, this proposal. It actually reads like, actually, yeah, maybe I mishear this a little bit or misheard this, but actually we should have done this some time ago. And really what we've done here is just wait for a retirement as a trigger point. But be that as it may, it seems like this is eminently sensible, and it's going to the team that can run it in a I cannot believe we're talking about analog to digital in 2025, but anyway, we are. But it sounds like eminently sensible. My question actually, Andrew, is really about sort of almost like, why are we even having to talk about this at the IJB level? Because this is a specific contract, and I don't think we actually talk about, in my time here, I don't think we've ever had a conversation about individual contracts. And I'm not saying that was a wrong, I just interested why this has come to the IJB, and others regular contracts have never come to us, I don't think. And it feels very operational. It looks eminently sensible. I'm going to support it, but I'm just raising the why are we, what is it, what are officers asking of us in terms of our contribution here? Because it feels like it's just very sensible, and it's just operational.
Laura, do you want to try and answer that question?
Yeah, super quickly. I suppose it's just because it is a significant change to the service that was sitting within the partnership. So the IJB had a say over, okay, community alarms as such, and now all the staff and the service and the budget are coming out of the IJB and going back to the partner. So I think it's right that your IJB is cited on that, and the strategic planning group were also cited on it to raise concerns like Shameen has. Okay, can I just check this? Can I just check that? So as an IJB, you're comfortable with it, and it's great that you agree with it, but I think it's right that the IJB are cited. What you wouldn't want is for 2 years down the line and we say, oh yeah, we gave that service away. We just forgot to tell you. So I think it's important that you are cited on it and you agree to it.
But it's not from the IJB, right? Because we don't employ anyone. So you mean from the Health and Social Partnership? Do you mean? I mean, we don't. These people don't work for the IJB because it doesn't exist.
No,
like
but
that.
as a partnership. So I'm trying to think of another example. So you've just heard all about the carers, for example.
Yeah.
Now
Yeah.
it could be that the council, I don't think they can, but the council could say, actually, the Carers Act money, we're no longer going to pass it over to the IJB. We're going to keep it and deliver carers services ourselves. You would want some say in that. So it's a similar thing. It's the partnership are delivering the service. The IJB are, if you like, directing, okay, this is how we want our services to be. So I think you want to be cited on services that are being delivered through the IJB, through the partnership.
Okay. I mean, it seems like the result, the proposal is that there'll be no audit through this. There'll be no impact on clients, as you call them, which I think is absolutely important. No change in the cost element. So to me, like I said, it's left pocket to right pocket. I'm sorry, and therefore, yes, agreed.
Okay, good.
Tricia?
I think that I'm not worried particularly about the transfer to the of the services, although I agree with Laura's point that we want to know about it. I think for me, we have now been taught at our development session to have the words integrated impact assessment tattooed on our hearts. And I do worry about these kind of services because I've seen, again, this is slightly bringing personal or rather professional experience in, because I've seen an awful lot of people who've declined services, and £5.80 a week or whatever may seem like buttons to some people, but a lot of people decline this kind of service on the basis that I couldn't possibly afford that, and they may or may not tick all the right boxes in terms of getting it paid for. So I'm wondering how many people are missing out on this kind of service and care. And I'm just very mindful of integrated impact assessment. I would happily pay that amount of money a week to keep myself or my, those near and dear to me safe. But I just think it is quite a lot of money, and it worries me that this is not actually as widely available as we don't have as universal coverage as we perhaps should have.
Laura, do you want
me to
briefly respond?
Leslie, if that's okay?
Yes, that's fine.
So first of all, great that you've mentioned an IIA, Tricia. You played attention at the development session. Really pleased. Thank you. There was an IIA done on this particular proposal, but we didn't need to do an IIA. So the IIA said it's okay, it's not affecting, or the proposal's not affecting equality groups, so we didn't have to progress. So Kate, who you now know, did that with Leslie's team. In relation to the charges, that's actually a separate matter.
Yeah.
So to play into Jonathan's hands, the charging isn't delegated to the IJB. It sits with the council. So
Yeah.
you won't
It's
have
a separate
seen
thing.
the delegated, the paper around the charging, nor the IIA around our charging policy, because I had to take that to the council because that remains with them. So, but for your reassurance, there was an IIA done on the
Okay.
charging and on the uplifts. And you were right, we are concerned that some people may not be able to afford it. So what we have is an appeals process that people are able to, and that Raymond will be part of, that people are able to say, I can't afford this, and then we can look and do a kind of financial check to say either actually you can, or no, we can see that you're under financial hardship, so either we need to do some income maximization to make sure that you can afford it, or there's sometimes in relation to particularly people with mental health issues or on the CTOs where we would simply waive the charge. So there are mechanisms in there to make sure that people who can't afford it are able to afford it, or we look at amending the charge. But that will be for Raymond to feed into the appeals process, which he will do, to look at some of those.
Yeah, thank you. That's actually very helpful to know. So this particular thing, which is the transferring of the service, doesn't need the IIA, but the actual
The charging element, you're
has
absolutely
had
right.
a separate IA, and I remain unhappy about it, because I still think there are people who, you know, I want to keep my cat, and therefore I have to, you know, they might prioritize cat food over, and it's when you say that's a personal choice, and when you say that's actually deprivation, it's a complicated area, and Andrew will want us to finish on time, so I will shut up.
Yeah, and you're right, and it is about capacity and ability for people to make decisions, and some people choose their cats over the alarms, and we have to respect that. But yeah, it's a big conversation that we often have.
Indeed, thank you.
Two final very brief comments from Raymond and from Isabel.
Yeah, super brief, but just for Patricia, you know, it'll not surprise you to hear that this is a conversation, but Laura just said we keep coming back to it. I've got a report up in front of me, which I can't stick in the chat for some reason, from 2017. Deloitte were commissioned feasibility study for the provision of universal telecare services for the over 75. There was a desire then to how can we make this free at a certain point for all of these reasons, and it never, nationally, this was not a local thing, it never managed to take off for, I'm sure, lots of very good and understandable reasons.
Thank you. Isabel?
Just so we do have, as Laura said, the charge and appeals group, and there's a range of us on it. I'm on it as well, and where we're looking at is that, you know, the risks in relation to the individual as well. So it's not just done on whether you can financially manage. You know, we'll decide not to charge, even if someone might have the funds, because of the risks, and we're planning to move it because of the risks associated with that. So that's what can happen at times as well. It's a real range of us and different ideas from different sources on whether people are actually needing it.
Thank you.
That's great. Thank you. I think we've given this a good opportunity for debate and conversation. Leslie, there's 3 recommendations that you're asking us there. I'm content, and we've hopefully most of those issues have been clarified. Are people happy and content? I'm seeing plenty of nods around the table. So thank you very much indeed. Agenda item 11 is just to say that there is a link through to the minutes of the Audit and Risk Committee, and this is our last meeting now until the 25th of September. I know the school holidays and things, so can I take this opportunity to wish people a pleasant summer and a break, and then we will reconvene in September. So thank you one and all. Take care now.
Thank you.
Thank you.
Thanks.